I'm Nurse Dani, and I'm here today with Dr. Galt from Intermountain Murray Vascular and Vein, and I'm going to give him a moment to introduce himself, but before that, I just want to introduce our topic today. We're going to be talking about varicose veins, which is a common issue that a lot of women have, so he's here to answer all your questions about it today. Dr. Galt, tell us a little bit about yourself.
Well, as Dani said, my name's Dr. Spencer Galt. I'm a board-certified vascular surgeon. I don't come from the Intermountain West, but I've been here for the last 25 years, quite happily. So I'm a vascular surgeon. So we take care of all parts of the circulation. We take care of problems with arteries, but a big part of our practice is that we take care of veins as well. And varicose veins is a substantial part of the practice that my colleagues and I take care of over in our Murray office right across from Intermountain Medical Center.
Okay, so great. People know where to find you if they have questions later and would like to be seen. So let's start with what varicose veins are.
So varicose veins are, simply speaking, dilated, bulging veins in the legs. So we've all seen varicose veins. A lot of us have varicose veins, but they're veins that you can see. They're superficial veins. They occur right under the skin surface. You can feel them. They stick out. People know what they look like. Varicose veins can be very achy. They can be very problematic. So there are reasons to take care of varicose veins.
Not just cosmetic.
Not just cosmetic. And in fact, most people who require therapy for their varicose veins, it is for medical reasons.
Someone asked a question on Instagram yesterday, and they wanted to know if varicose veins can cause like sleepiness in the legs or any numbness.
Varicose veins can cause all kinds of symptoms in the legs. They cause all sorts of different things. The typical symptoms that we think about with varicose veins are achiness, heaviness, swelling, things like this. Varicose veins can cause some restless legs sometimes. Sometimes they can cause some numbness. They can cause some sleepy feelings in legs. And sometimes these symptoms are a little bit difficult to discern. And, sometimes somebody will describe sleepiness as kind of a heaviness sensation that I might call it. So varicose veins really have all kinds of clinical presentations. And part of our job, if you come to see us, is to help you sort these out to determine whether or not the veins might be causing your problem or we have to check another pathway.
Yeah, it might be something else. And then you can give them options.
Correct. Exactly.
So for someone who comes in with varicose veins, how would that appointment look? Or what kind of options might someone have? What would you suggest?
So the first thing that we'll do if somebody comes in with varicose veins is we try to get to the underlying cause of varicose veins. And in most situations, we don't know the underlying cause. We know that varicose veins run in families. We know that women are more likely to get them than men. We know that pregnancy can cause varicose veins. But in most cases, we don't know what's actually caused the varicose veins. In some circumstances, people that have had vein clots in the past can also get varicose veins. But that's really the exception, not the rule. Most people have what we call idiopathic varicose veins. Idiopathic is a fancy medical word meaning we don't know.
And it's not necessarily due to something scary in most cases.
No.
It's just something that we should address, especially if it's bothering you.
Absolutely, yes.
Okay, so what different treatment options are available?
So the first thing that we'll do as we move into the treatment options for patients is we get an ultrasound. Everybody who has varicose veins will get an ultrasound of the veins in their legs. It's a very powerful tool for us to get to the underlying cause of the veins, figure out just what kind of treatment we need to do. The nice thing about ultrasound, of course, is that ultrasound is painless. It's inexpensive. There's no radiation involved. So it's a very safe test, can be done anytime, any person. There's no known side effects to ultrasonography, but it is a very powerful tool. So we need to talk, I think, a moment about the physiology of varicose veins.
Yes, let's do.
We have a circulatory system that contains arteries that take blood flow out to the legs, to the arms, and so forth, and then veins bring the circulation back. Humans stand upright, so gravity is working against us all the time. Gravity is pulling back blood to the floor. So our veins actually have a way of encouraging blood to get back up to the heart. And there's a number of ways that blood gets back to the heart, but the easiest one to think about is our heartbeat. Our heart, of course, is the pump pushing blood through our body the whole time. So if we're standing upright and the heart beats and blood is coming from the floor to the ceiling, vein valves open like this, and then when the heart relaxes, the valve should shut. And this prevents blood from going backwards down the veins.
It's like shutting a door.
It's exactly right. It's a one-way valve. So if the valves don't work properly, and the valves are doing this, which is what's true in a lot of varicose vein patients, then blood is pooling, and it's pooling in those veins. It's making the veins large. It's making them ropey. It's making them painful, possibly. But we want to get to the function of the valves, and that's what an ultrasound will do for us.
Oh, okay.
Now, there's two systems of veins in the body. There's a deep system and there's a superficial system. The deep veins run down inside your muscles, near your arteries, by your bones, and the deep veins do the lion's share of the work. Most circulation comes back through the deep veins. The superficial veins are the ones that we can see, particularly in very lean people who may not even have varicose veins. They're just visible, and certainly in people with varicose veins. So we look for reflux or leaky valves in veins. And there's one vein in particular that we look at, and it's called the saphenous vein. And the saphenous vein runs right up and down the inside of the thigh from the ankle to the groin. And the saphenous vein is usually the root of the varicose veins. It's generally the cause. So it's very important for us to know if the saphenous vein is incompetent or has bad valves. Or one could even say varicosed, but you can't typically see it. We can only see it on the ultrasound. If the saphenous vein is affected, it's very important for us to treat the saphenous vein. And we'll talk about treatment options in just a moment, because all those other ropey branch varicosities that you see, if they come off the saphenous vein and you don't treat the saphenous vein and you just treat those varicosities, you'll get more.
Yeah.
So we're going to treat the saphenous vein. Should we move into saphenous vein treatment right now? Okay. Once upon a time, there was something called a stripping, and most young people probably haven't even heard of a stripping.
I saw one in nursing school.
Yeah.
It looked
something, wasn't it?
So traumatic, yeah.
I did quite a few strippings in my younger days. I'm old enough to have been around in the days of strippings. And a stripping literally was we made an incision down somewhere near the ankle or in the lower leg, and we made an incision in the groin, and we put a small plastic tube through there, and then we screwed on something that looked like a mushroom cap and went and stripped it out. And it worked, but it was rough on you.
Yeah.
It was done in the operating room with anesthesia. People didn't stay overnight, but it was uncomfortable and it was unpleasant. Rather than doing a stripping, in this day and age, what we do is something called a thermal ablation. Thermal is heat, and ablation just means make it go away. So now, in our office, we do these all in our office now. We'll have somebody come into the operating room, lie down on the table in our office. We happen to use something called sedation, so we kind of make it, it's kind of like a colonoscopy, kind of, lighten things up. And then we will find the vein in the lower leg with an ultrasound. And then I'll give you a little bit of local anesthetic, a little Novocaine. Use the ultrasound probe, and with a needle, stick the needle in the varicose vein. And then through the needle, I place a wire. And then over the wire, I put a heating probe. And I put the heating probe right up to the groin, and I'm watching it with the ultrasound. I can see just where it is with the ultrasound. Then we numb up all along the saphenous vein. With the ultrasound, I inject local anesthesia along the vein, and then we fire the heating probe. It takes about 3 minutes, and that's it. It's done.
That sounds so much better than a vein stripping
People
procedure.
get up and walk out of the office when we're finished. Yes.
That's amazing.
It's very effective, and it works very nicely. It's much less uncomfortable, and it does the job.
So how does the heat affect it and stop it from coming back?
It effectively cauterizes it from the inside out. So when the vein is, the heating probe is inside the vein, and the vein is around the heating probe, and the heating probe is fired, the vein goes like that, and just squeezes right down. And eventually your body will scar it off. So it becomes invisible even to ultrasound over time. Can't even see it on the ultrasound.
So the tissue exists, but it's like a dead end.
Yeah,
basically.
Exactly. That's precisely what it is. Now, if you have a lot of other bulging varicose veins, what we will also typically do is then numb up in the area of the leg and make tiny little incisions. They're about yay big. And we reach in and, quite honestly, we use something that looks like a crochet hook. We reach in and we pluck the veins out gently. We just put a little finger pressure on there. The bleeding stops. We put some tapes across that, and that's the end of the procedure.
That doesn't sound so bad.
It's not bad at all.
Hopefully, for anyone who's been scared of going in and getting them checked out, this is a little reassuring to them to actually know what's on the other side of that appointment.
Yep,
what they can expect.
We have great success rates with it. It's an effective treatment. People tend to be very happy with the procedure, and so yeah, it's a different thing than it was years gone by when it involved a trip to the hospital.
Is there a chance that the same veins could be affected again?
It won't be the same veins. So by treating the saphenous vein, we have really lowered the probability of recurrence, but we can't make it go away entirely. It is possible that more varicose veins will come. So this gets into the issue of prevention. And what I tell my patients, even after all is said and done, that wearing compression stockings, and it's just the knee-high compression stockings, not the ones that, we will use the thigh-high ones around the time of treatment. But the knee-high compression stockings then, if folks find that they're going to be on their feet long periods of time, if they're going to be, say, sitting in church for a few hours, if they're going to be sitting on an airline for a couple of hours, having compression stockings on can help slow down or actually prevent the recurrence of varicose veins. Interestingly enough, exercise on your feet is not such a problem because exercise stimulates the
blood
circulation.
Flowing.
Exactly. Yeah. But I'll tell you a little anecdote. when I first started in this business some years ago, we'd have athletes. Of course, there's quite a few athletes in Utah, and we'd have athletes come into the office with varicose veins, and we'd talk about compression stockings. And I said, but when you're out running or cycling or whatever it is, like you hiking or skiing, you don't have to wear those stockings. And then we had a group of people who would come in and say, well, gee, I wear them when I do that because they feel so good. And now, of course, you see there's a whole industry of sports compression.
Yeah.
And this is where this all came from. Yeah.
How does the compression help?
So if vein is pooling in the leg, if blood is pooling in the legs, so there's pressure coming down. So basically all we're doing is working from the outside in to put pressure in the other direction.
Trying to effectively
squeeze it back out. Because one of the reasons that people have symptoms related to varicose veins is the distension of the veins. Veins have nerves in them. And if you distend the veins, the nerves get activated, and that's why they become painful. So by squeezing on the outside, we help keep the valves healthy, we help keep the blood out of the veins, and help with both symptoms and recurrence, presumably.
What about sizing compression socks? Because can they actually be too tight? Do you need to worry about that, or do you want them to be really, really snug?
You want them to be snug. There are some compression stockings that are very, very tight, and none of the compression stockings on the market is too tight
Good to know.
From a patient damage point. Some of them will be tight enough you'll be uncomfortable.
But they're really hard to get on, but worth it.
They can be difficult to get on. They come in different grades, and generally for most people with varicose veins, a medium grade. So they're graded by pressure. Pressure is graded by in millimeters of mercury, just like your blood pressure. If your blood pressure is 120 over 30, it's 80.
80, yeah.
Yeah, if it's 120 millimeters of mercury, then that's 120 over 80. So the compression hose are graded in millimeters of mercury. And they'll say 20 to 30, for example. So we want more pressure at the bottom and less pressure at the top to encourage blood to go up. So a 20 to 30 will be 30 at the bottom, up to 20 at the top. And for most people with varicose veins, a 20 to 30 is adequate. I wear a 20 to 30 when I operate, and I stand in the operating room long periods of time.
Oh, see? An example of what we should all be doing.
Yep, they make my legs feel better.
Yeah.
And they can be tough to get on. Some things, there are devices that can help people get them on if they need them.
Especially for elderly patients.
Yes, exactly. One little trick that one of my patients taught me that I've disseminated to lots of patients is if you take a nylon knee-high, put that on first.
They slide right over.
Slide more easily
reduces
over
the friction on your skin.
Exactly.
Oh, that's a great tip.
Yep.
So back to prevention.
Yes.
I asked you before, and I want everyone to hear it. Does crossing your legs increase your risk of having varicose veins?
I'm going to go on a limb here and say no.
Okay.
There is no evidence at all that crossing your legs causes varicose veins. I don't see why it would, personally. There's no physiologic basis for it. So, no, I don't believe that crossing your legs, and I know of nothing in any sort of medical literature that says it does. I'm afraid it's a myth.
Well, that's good for everyone to hear, I'm sure.
Yes.
Anything else that people can do or not do in day-to-day life? We've talked about exercising is good, compression stockings, doesn't matter if you cross your legs. Anything else that people could do to reduce the risk?
Weight control is very important. Obviously, if you're carrying more weight, then there's sort of more pressure on everything. And so weight control is an important component of trying to control your symptoms and controlling the development of varicose veins.
Another good reason to exercise.
Another good reason to exercise. Well, we could get into the millions of good reasons to exercise.
Yeah.
But
right.
Yes, certainly for your vein health and for your artery health, exercise is very important. One thing that we've had a nice conversation slipping away here, but we really haven't talked about sort of all the reasons to take care of varicose veins, because there are more than just symptoms. People can sometimes get clots in their varicose veins. Varicose veins are more prone to clotting than a non-varicose vein.
And that's when it can become dangerous.
Well, no, and this is an important thing for us to discern. A superficial vein clot hurts, feels like you have an infection. It'll get red, it'll be inflamed, and it's very tender, but it's harmless. A deep clot, that's the kind that can be harmful. However, if you have a superficial vein clot, or you think you might, it is worth being evaluated by the emergency room or the Instacare, somebody like that, because sometimes people with superficial clots will have a deep clot, and we can rule that out with an ultrasound. If there's only a superficial clot, as I said, it's not very pleasant, but you can make it through it. After the superficial clot has resolved, the inflammation has gone away and so forth, that's another reason to think about, even if they didn't bother you before, that would be another reason to think about having your varicose veins taken care of, because when you've had one, you're liable to get another. People with bad venous disease, and this is affecting a much smaller proportion of the population, can actually get ulcers on the inside of their legs down by their ankles. And that comes from very severe varicose vein disease, but it is something that can happen to varicose veins as a result of varicose veins. And we'll take care of patients like that as well, although that's certainly the minority of our patients.
Mm-hmm. And pregnancy. So speak a little bit more to that. And the other question that we get a lot on Intermountain Moms is, say that I've had one baby,
Yes.
but I anticipate that I'll have at least one or two more. When should I seek treatment? Should I wait till I'm done having kids?
I think it of course, it's an individualized thing, and most of it would depend on your symptoms. Some women will have, I can only tell you what they tell me, never been pregnant. Some women will have pretty severe symptoms with their varicose veins when they're pregnant, and after they deliver, they get better, and they get substantially better.
And this is caused by the weight of the baby.
The weight of the baby, and also
compressing the veins.
And pregnant women have hemodynamic changes. They've got a bigger blood volume, their heart rate goes faster. But yes, the weight of the baby pushing on their veins has a lot to do with this. So some women will get much better after their baby is delivered, and their varicose veins, the veins won't go away, but they'll be much less noticeable, and often the symptoms will get much better. If that's the case, I'd say, well, it might behoove you to wait until you're finished having pregnancies before having the veins treated. On the other hand, if the pain is unpleasant, if it's severe, or if you do plan on getting pregnant again and it was so bad you don't want to go through that again, that might be a time to come in and see us.
Good advice.
We would not say to somebody, oh no, we won't do this until you're finished having pregnancies. We talk about it. We decide on an individual basis, gee, would it be wise for you to wait, or gee, should we move ahead now? Of course, the one thing we don't like to do is take care of veins during pregnancy.
Yes. Avoid anything that you can.
Exactly. We don't know how much better the veins are going to get. Of course, we don't want to be subjecting a mom to the drugs and things like that aren't absolutely required during pregnancy. So we're pretty hands-off during pregnancy, and we'll be happy to see you afterward.
Now, someone actually did ask a question on Instagram yesterday. They said, I need surgery for my varicose veins. So she's met with her doctor. They've determined that's necessary. Why do I need to stop nursing for the surgery?
It would really depend on the drugs that are used during the surgery. It's a medication issue, and that's really the only issue. Certain drugs can cross into the mother's breast milk and then, of course, be transmitted to the baby.
And I would say to her, too, she doesn't need to stop nursing entirely. She may just need to talk with her doctor about pumping and dumping for a certain amount of time. So you don't need to quit nursing altogether.
Correct. And that is certainly an approach that we've followed. We've just said, generally, I think our policy is 48 hours. We'll just say pump and dump for 48 hours. After that, we know everything's out of your system. And the other option is, I did mention using sedation during the procedure. Some people choose not to have sedation. Some people choose just to have the local anesthesia. If we don't use the sedation, then
you don't need to worry about that.
Correct. Exactly.
So some good options for that mom who was wondering. So can we talk about spider veins for a moment too, and how they differ and how the approach is different?
Yes. So spider veins are really varicose veins in the skin. So they're tiny little veins within the skin, and physiologically they're quite similar to varicose veins. But whereas varicose veins are under the skin, spider veins are in the skin. Okay. Spider veins can cause symptoms. They can cause itchiness, achiness, things like that. This can happen. But I will tell you, unfortunately, virtually all insurance companies treat spider veins as if they are cosmetic. So even if they are,
out-of-pocket expense.
It's an out-of-pocket expense, and we do spider veins in our office. Actually, one of the nurse practitioners that works with me is very skilled at taking care of spider veins. She does it all. I don't actually do the spider veins myself, and she's very skilled at it. And we certainly have lots of people come in and have their spider veins taken care of. And it is an out-of-pocket expense, though, and that's something that we can certainly discuss when we come in. Have you seen in the office?
And what is the treatment for them?
Generally, it's injection sclerotherapy, it's called. So we inject a sclerosant material, which is basically a little scarring material, into the vein itself. It's done with a tiny little needle, and you actually have to wear these microscopic lenses and so forth to see it. And then the needle is injected right into the vein, and then this sclerosant is injected into the vein. And because these veins are in networks, you inject a little bit of sclerosant, and it goes bzz, all out through these veins.
I've seen this on videos, and it's incredible. It's like magic.
Yep.
And how long does that treatment last? Do you usually have to have it repeated?
So sometimes the veins that are sclerosed are typically gone, but there tends to be a lot of spider veins. So it may require several treatments. And again, you may develop more. So we have patients who have come in on, years apart and have chosen to have treatments. Some people, as you can imagine, the smallest spider vein is unpleasant to them and they'd like it dealt with. And then other people wait until it looks a little bit more unsightly in their mind, and then they have it taken care of.
Yeah. So I've heard a few recurring themes. It sounds like to seek help if you're having symptoms or if you're concerned about it. Even if it's just cosmetic, there are options for all of these things.
I think anybody who has varicose veins who really has any questions about it at all, there's, of course, a lot of good information on the internet. Intermountain Healthcare has good information on this, but we're certainly happy to see you as well. And I'm not quite ready to cede my whole career to Dr. Google.
Right.
You can come and see us and we can give you some more information.
We definitely need you. So is there anything else that you think would be helpful for women to know about veins?
I think we just want to reinforce some of the important things about treatment and prevention. So prevention, certainly, and we've talked about these, but they're worth talking about again. Exercise, good weight control, compression stockings, those are the three big items. In terms of treatment, again, if you think they might be causing you trouble, if they feel like they're causing you trouble, if you have questions about whether they're causing you trouble, come by and see us and we can talk about it. And again, it may not be your veins. And my colleagues and I are fairly skilled at teasing this out sometimes. And if we don't think your vein problem, or if we don't think your veins are causing you symptoms, I'm not going to offer you a varicose vein procedure because we're both going to be disappointed if I do.
Right.
So we will carefully consider this. Well, one other thing came to mind and it slipped it, but it'll come back to me in a moment.
Happens to the best of us.
Yes.
We're really lucky to have you in our area. Thank you so much, Dr. Galt, for being with us today. And tell everyone one more time where they can find you. So
it's the Intermountain Murray Vascular and Vein Clinic. We're on the Intermountain website. Our phone number is 801-313-7500 if you'd like to call us and make an appointment. They're probably the two easiest ways to get in touch with us.
Awesome. Thank you so much for being with us, and thanks for joining us today. Of course, if you have questions for me in the future, you can ask them on Instagram or Facebook. Have a great day, everyone. Thanks.
Thanks, Dani.
Thank you.
You're welcome.